Cheryl, can you hear us?
Yeah.
Okay, good. You must be audio only because we can't see you, but we know you're here.
I'm here.
Okay, good.
I just need to, I can hear you, but I'm going to turn you up a little bit. We have
Hello.
Hello. Who just joined us?
This is Nelda Goodman from the American Indian Family Center.
Hi, Nelda.
Hi.
We're going to get started in just a couple minutes. A few more people come and join us.
Okay, I'll put you on speakerphone and mute my button here.
Okay.
All right. Oops.
And then you can hear the clock ticking.
Actually wondered if that shows up on the recordings or about people. It shouldn't be that loud, but
because the speakers are here, not up there, right?
right.
So yeah,
We can hear it.
Yeah.
The two people.
Okay, good. I don't have to rush out after this one.
There's somebody else there, but my glasses are.
Oh, it's just a phone number, but that came up last time, and then it was like maybe somebody's who's already on their phone connection.
Could be.
Like it wasn't a separate person last time. Or they wouldn't answer me anyway.
Marissa Mitchell. Well, we're going to get kind of a nice slow start here because I think people will be joining us for the next few minutes. I'm Rebecca Buller, and you've just joined the Wayside Women's Services Echo session for today. what we're going to do is start with introductions of the people who are here. And if you could also please go into the chat and just type in your name and your organization. That'll help us with attendance. It also helps us if you have more than one person in the room to list all the people in the room, because we won't know. We only see the one, whoever's computer or phone has called us. We only see the one person. So there are multiple people. Hi, please sign in the chat. And we're going to go ahead and start with Cheryl. Why don't you introduce yourself? You have to unmute before you talk.
Can you hear me?
Yes.
Oh, okay. I'm the public health care staff Mothers First with Ramsey County.
Okay, so that was, did you all hear that was Cheryl Hansen with Mothers First in Ramsey County. Let's go to Ann.
Hi, everyone. I'm also with Mothers First. I'm the supervisor here.
Great, welcome. Marissa?
Hi.
And you are with what organization?
I am with Tugwee with Fond du Lac Recovery Services.
Wonderful, welcome. And Nelda? Do you want to introduce yourself, Nelda? You'll have to unmute. Well, while Nelda's figuring that out, I can't see who's up in the right-hand corner.
Okay.
Oh, there's Nelda. Go ahead, Nelda.
Okay, I just have to do *6. Okay, my name is Nelda Goodman, and I'm from the American Indian Family Center in St. Paul.
Wonderful. Thank you for joining us. Maria, would you like to be next?
Hi, I'm Maria. I'm with Mothers First program as a peer recovery specialist.
Wonderful. Thank you for joining us. And then there's one more person on the phone, a 612 number, possibly. It may just be the connection for a computer hookup that has their telephone running through. And did I miss anyone so far? No. All right. Well, today we're excited. We're going to learn more about Bridge to Benefits with Stephanie Hoganson. And Stephanie's with the Children's Defense Fund. And I'm going to turn things over to you and let you run the show from here, and we'll have time for questions when we get done.
Great. Well, good morning, afternoon, everyone. So like Rebecca said, my name is Stephanie Hoganson, and I'm the Outreach Director at Children's Defense Fund, Minnesota. And we have several initiatives at the Children's Defense Fund. One of our most well-known initiatives is our Bridge to Benefits project. I don't know if they can see my slides yet. Not yet. Okay. And so I work with the Bridge to Benefits project and a few other of our programs and advocacy efforts around improving economic stability to children and families across the state. And our Children's Defense Fund, as you may know if you're familiar with our organization, we're a national nonprofit organization that is located out in DC, and then we have 8 state and regional offices, including the one in Minnesota that's been around for just over 30 years. And we were founded by Marian Wright Edelman, a well-known civil rights activist, still our president and CEO out in DC. And our mission basically is to ensure children have what they need in childhood through the help of a supportive community so that they can be successful into adulthood. And in Minnesota, besides Bridge to Benefits, I just want to provide a little bit of background of what we do. So first and foremost, we're a legislative advocacy organization. So we lobby at the Capitol on behalf of children and families for policies and programs that support their well-being. And we were kind of founded on providing access to healthcare. So over a decade or two ago, we were instrumental in the creation and expansion of Minnesota Care and medical assistance in our state, as well as currently, protecting the healthcare gains that have been made for children and families in recent years. But we have recently turned our attention to issues around child well-being and economic stability, including funding childcare programs, early education programs, as well as creating paid family leave and tax policies that support children and families in our state. And then we also do some youth programming through our Freedom Schools, which are summer after-school literacy programs that support child development, their love for learning, as well as their involvement in community in a culturally relevant environment. So we have curriculum that's rooted in Black and African American communities, American Indian, and Hispanic and Latino. And we serve about 1,200 young people through those programs in Minnesota. And then kind of besides our Freedom Schools, the closest we get to direct service is our Bridge to Benefits project. So Bridge to Benefits has been around for almost 10 years now, or 12 years now. And it's a web-based project that connects families to work support programs and tax credits through an online screening tool that takes about 5 minutes to complete. And households just enter their income and family size, and it populates their eligibility for an array of public work support programs and tax credits. So one sec while we get the slides up. I just went for it, so. There we go. Okay. 1 second here. So I already got going. So I told you about all of our great work. So to dive into Bridge to Benefits. So like I mentioned, it's a web-based project, and it has the screening tool, and it screens for the programs you see listed here. So all 3 of the Minnesota healthcare programs, medical assistance, Minnesota Care, and the advanced premium tax credits, SNAP, formerly food support, school meal program, energy assistance, child care assistance, WIC, and then 2 tax credits that are targeted for lower income working families, the federal earned income tax credit and the state's working family credit. And we are the Children's Defense Fund, so we did build the site kind of to work for families with children, but it does work well for single adults and even seniors. Of course, we don't screen for Medicare or senior specific programs, but many of these programs have eligibility criteria that can be met by single adults without children and seniors. So we encourage those populations to use the tool. And with medical assistance, of course, we screen for medical assistance for adults with the Medicaid expansion, which I'm sure many of your clients that you serve that don't have children or have children benefit from. And our goal with Bridge to Benefits, of course, is to improve child outcomes. And we know that's done when we increase family income and resources to a household. And really, even a small amount of income, research shows even as minimal as $1,000 in annual earnings can have long-term outcomes and improve educational outcomes in young children. And so this is kind of our premise for supporting these public programs, as well as supporting access to wages that can support children and families. And so we, like I said, we created Bridge to Benefits in about 2007, and it grew out of a healthcare outreach initiative where we were working to enroll families in medical assistance in Minnesota Care. And those families would come to us and say, you know, it's great to have access to health insurance, but my lights are going to get shut off, or there's no food in my fridge. How do I get connected with programs that can help with all of my basic needs? And so we thought, all these programs are administered by different state agencies. They have different application requirements. They're very complex and complicated for families to navigate. So let's make it easier for them and try to address the underutilization of the programs by putting the screening tool all in one place and providing users with the information of what they might be potentially eligible for, the exact steps to apply, and then kind of the best part of our site is a direct connection through an email referral system to an application assistance organization that will follow up with the user and help them apply and enroll in the program. And so these programs, of course, are all federal entitlement programs, meaning if a family applies and they meet the criteria, they can enroll and receive the benefit. So with the exception of child care assistance, which many of you may know is a block granted program, so many counties in the state have waiting lists for their basic sliding fee program. And as of right now, we estimate about 82% of income eligible children can't access that program, partially due to that lack of funding. And then energy assistance is a similar model block granted program to counties. This program is about to start up soon, so making sure your clients know about it. It runs October through May and helps families pay with their electric and other utility bills. But funds do quickly run out, particularly in highly populated counties, so not all eligible households enroll. But you'll see even half of our uninsured population in Minnesota are actually eligible for Minnesota Care or medical assistance or not enrolled. So there's a significant outreach need. And a high percentage, since I heard a couple people specifically work with the Native population, our uninsured rates for the Hispanic and Latino population and Native population in our state there's significant disparities, and many of those populations, actually all of them, most likely nearly all of them in the American Indian population are eligible for some type of health services due to medical assistance in Minnesota Care and other treaty rights. The school meal program, about 10% of eligible children are not enrolled. That's a one-page application. That's why you see the model for how these other programs could be adapted to increase enrollment. About a third of eligible people are not enrolled in SNAP, and that number used to be closer to 60%, and we did a lot of work, so it shows that outreach helps. About a quarter of families aren't enrolled in WIC, and almost 1 in 5 of eligible households are not claiming those valuable tax credits. That could mean up to a fifth of their income back during tax time. And there's a variety of reasons why families, don't enroll in these programs. Lack of awareness. We do target working families, and sometimes they think, oh, my sister applied and wasn't found eligible and she makes less than me or whatever, but they just may not understand the complex rules and processes. And of course, transportation, stigma, those things feed into it too. And then, of course, these programs benefit children and families and the people who enroll in them, but they also benefit our communities and local businesses significantly, with hundreds of millions of federal dollars flowing into our local economies, getting paid to Xcel Energy and childcare providers and Cub Foods and other places that accept SNAP and EBT and WIC. And of course, the healthcare providers, many of you may receive Medicaid or Minnesota Care reimbursement that drives your ability to serve the populations that you do. And so this is just a quick snapshot of the people we're trying to support. This is the rates of low-income children living in low-income families by race and ethnicity, and low-income is defined as below about $48,000 a year, 200% of the federal poverty guidelines. And you'll see the 1 in 3 Minnesota children live in these households. I'm sure most of the children in the families you serve are included in these numbers. And of course, unfortunately, in Minnesota, we have significant racial and economic disparities by race, with more than about 3/4 of Black and American Indian children living in these households.
You do.
So Rebecca did ask me to kind of give an example of how Bridge to Benefits can really impact a specific family. And I know, I'm guessing a lot of your families you work with might be a single parent or 2 parents. And if they're currently in recovery services, they may not be working yet, but hoping to get a job. So this just gives a picture of what full participation in the programs really does, because a lot of families are enrolled in 1 or 2 of the programs on our site, but the full benefit can't be kind of provided to a working family unless they're enrolled in all the programs for which they're eligible. So this is a family with 2 working parents and 3 children to an infant, a preschooler, and a school-age child. And if they're working at the minimum wage, they're earning just under $40,000 a year, and about 500,000 jobs pay less than $10 an hour. And the minimum wage is now $9.65 because there was an inflation adjustment, but this is a snapshot for a little bit before that happened.
You might have to go back into the PowerPoint.
Oh, oops. There we go. So this looks at some of their costs of their basic needs. This is that family living in Dakota County. And you'll see they would have significant costs for just a bare bones basic needs budget. That doesn't include other expenses like diapers or debt or anything like that. But after enrolling in public programs, their school meals would be free. Their child care assistance copayment would be reduced from $1,500 at full cost to $100 about a month. And that would be for both children that aren't school age. And then their tax credits would combined pay down their taxes owed and still be nearly $7,000 back in their pocket during tax time, which we know often families are then able to catch up on former expenses, finally get the car fixed, whatever it may be. The parents would be eligible for Minnesota Care at a $32 monthly premium, and the children's would be covered under medical assistance for free. And then their SNAP and WIC food benefits would cut their food budget by more than a third. So to kind of look at this in a different way, families earning low wages just are never able to make ends meet at those wages. So this family would be $2,700 short each month just with that bare bones budget, not to mention they would have other utilities, school-related expenses, likely debt, diapers isn't even included. So they would be really short, and there's no incentive to work in this case. But after enrolling in all the programs they're eligible for, they'd have about $300 left over to meet those other needs. That would go pretty quickly, just thinking about diapers and formula, but at least they'd have some level of economic stability with the programs. And one reason we advocate at the Capitol for child care assistance is because if a family can't access that program, then it really puts a hole in their budget. This family wouldn't be able to make ends meet, even with access to all the other programs. They'd be $1,000 short. And of course, if you don't have childcare, you can't work. If you try to work when you don't have childcare, your kid might be put at risk in different environments. So it's a huge need across the state. So how Bridge to Benefits kind of works is we created the screening tool, of course, and it is a public website and screening tool, so anyone can go on it. We created it so it's easy to use for people to navigate and understand. However, we find that still families might struggle to get on it, use it in the right way. So we recruit screening organizations, service providers such as yourselves or food shelves, community clinics, other nonprofits that are trying to find resources for low-income families. And we provide free training and support to use Bridge to Benefits on a regular basis with clients. And so for those of you on the call, if using Bridge to Benefits with your client seems like something you'd be interested in, we can arrange for me to come out, do a training for anyone in your staff who would be using the tool with clients. And we also create a username and password so you can log into the site and receive some added benefits I'll talk about in a minute to becoming kind of that Bridge to Benefits partner. And partner is a loose term. We don't have any requirements or costs associated with that. It just means that you want to use the tool to connect your clients to the benefits, and then you get the username and password and all of that with when you sign up to be a partner. And then kind of like I had mentioned previously, the best part of Bridge to Benefits is we don't just tell someone you're eligible for these 15 different programs, here's the information to apply, good luck, go on your merry way. We've recruited application assistance organizations that are already out there assisting families to apply to these programs. And so we not only list, so if someone comes up eligible for medical assistance, we don't just list an application assistance or healthcare navigator in their county and say, call them. we actually have a direct referral system through our site where a client can input their contact information, send an email referral to that healthcare navigator. That organization will follow up with the client, call them, schedule a time to walk them through MNsure and make sure they apply and enroll. They'll answer any questions that they have about the program, the application process. If they need resources now, they'll help them navigate how they can get those. And then once they're enrolled, they'll also put a little ticker in their file for when they have to do their recertification for the program, and contact them and see if they can help them with that 12 months or 6 months or whenever that certification period is. So, and I'll demonstrate that connection that can be made directly through the site when I hop on there. But so as a Bridge to Benefits partner, as I mentioned, we provide a free training, and we come to you no matter where you're located. We're happy to come out, do a training for 1 or 50 or however many of your staff that would be using the tool with their partners. And then we provide a username and password so you can log into the website. And that login is very important. So right now, after this, you could go on Bridge to Benefits. It is a public site. But without having that login, there's a few features you don't have access to. So by logging in, we actually do a data collection for you on all your screens. And there's the ability to produce a pretty useful report that looks at the number of screens you completed, the number of families included or family members included in those screens, how many you connected to each benefit, and then an estimate of the benefits that you connected families with. And so the United Way, Bremer Foundation, the Community Action Agency, some state-based grant programs actually look at those data reports as something that contingent upon funding. It also helps people kind of determine their population needs and how they're serving clients. And then you also have to have that login to always have access to our email referrals to those application assistance agencies directly from the website. So in some cases, those email referrals are open to the public, but not always. So to be able to directly refer to those application assistance agencies so that clients can be followed up with and get the help they need to apply and enroll, you have to use that login. And then, of course, the program information on the site is always up to date. Because we are a legislative advocacy organization, we keep up to date with that. We work closely with the Department of Human Services and the other departments that administer these programs. In fact, Bridge to Benefits is actually the screening tool for ApplyMN, the state's online application for cash assistance, SNAP, and childcare assistance. So we're always making sure that the applications and information and eligibility guidelines on the site are up to date. And then we also are partners, and we do have, we've trained nearly 400 social service providers, organizations across the state to use Bridge to Benefits. And that network of partners, we've also started to really engage in our advocacy efforts to improve benefits access and family economic stability. So we, if there's going to be a proposed cut to SNAP, or when there was the proposal around Medicaid work requirements, we engaged our network of Bridge to Benefits partners in ways that they could advocate against those proposals or for proposals that would positively impact these programs. We also, our Bridge to Benefits partners alert us to issues happening in specific counties or administrative issues that are happening, and we've been able to work with them and the state to do some rule clarification around some of these programs in specific areas. So it's a really, the network of partners, it's really a reciprocal relationship, and it's been helpful to our advocacy efforts to improve these programs as well. So there's a variety of ways that organizations can kind of implement Bridge to Benefits and integrate the screening into their work. Kind of the best way we see it is trying to reach clients as soon as they enter, and typically that's when they're in a financial or other crisis anyways. For those of you who have and I don't know exactly how all of your programming works, but if someone's in a inpatient treatment facility, they're not going to be eligible for these benefits in the same way. Medical assistance, of course, but once they exit, they may need the economic support of SNAP or WIC or some of the other programs. So thinking about the intake process and the exit process is an opportunity to use Bridge to Benefits. And then, of course, screening on a case-by-case basis. Some screen over the phone through a hotline. We do have brochures that you can hand out and have families screen on their own, but of course we do recommend sitting down with them. And then some do it during different trainings or events, whether the client does it on their own with direction or it's done by a staff person going through. We also train volunteers to do it if you have home visiting programs, going into the home and doing Bridge to Benefits. It does work well on mobile devices. And we also have a paper screening tool for those times when you don't have access to the internet or the actual site. You can make sure you gather the information, go back, fill it out, and enter it. And this slide just kind of shows our reach. So in 2017, we did about 33,000 screens. That included 92,000 Minnesotans. And nearly 60% of each of the screens had the person screened indicated they were eligible and interested in at least one program, so likely not enrolled. And you will see kind of the top programs that families are eligible for are medical assistance, energy assistance, and SNAP. Last year, we brought almost $27 million in estimated annual benefits to Minnesotans. So I'm going to pull up the site real quick. If anyone has any questions, you can jump in as I'm doing that so we can see it. Okay. So the website's at mn.bridgetobenefits.org. And as I mentioned, it is, of course, a public site. It's confidential. It's free for anyone to use. So anyone could go onto it, hit this green start button, and do the screening tool. There are a lot of resources on the site, too, so you can learn about each of the programs, which is nice because they're administered by different agencies. Their rules are complex, and we kind of break it down in a simple question and answer format, and provide it in language that's easy to understand, and we avoid all that DHS jargon. And so frequently asked questions, it kind of asks a question, and then program by program, it'll answer that question. So, you know, this is about immigration status and how it might affect the eligibility by program.
Are we able to, are you able to, this is Maria, are you able to forward that PowerPoint to us?
Yes, you should have received it already.
Okay.
It was in the zip file, but yes, of course, double check the zip file that I sent out.
Sure.
And then if you have a problem, just email me and I'll send it to you.
Okay, thank you.
And it is also, if you scroll down to the bottom on the left sidebar here, a version of the training PowerPoint is under our publication and resources. So I'll, I think it's right here. And then we do have like a flyer about what is Bridge to Benefits, how to become a partner. We do have our brochures here that you could print, but you can also order them from me. And then if you're a clinic, if you know about clinics or schools, we do have some specific ways they can use Bridge to Benefits. But going back to all the applications, whether they're online, paper, they're all available on our website. We do have voter registration because we want people accessing these programs to vote and help shape the programs. And then we have a Find Other Help section that's kind of like the first place to go for help in each of these categories. Definitely not an exhaustive list. And in fact, we refer people to United Way 211 or minnesotahelp.info, but they can find a food shelf and learn about a couple programs that might help in each category. One other thing that we have is a low-cost healthcare directory. So of course, people who don't have insurance should use the screening tool to find out if they're eligible for the healthcare programs. But if someone needs free or low cost or sliding fee scale services, and we do our best to provide mental health and dental services as well, they can select a county and it'll pop up a variety of options for them. So that's something we also maintain on here. And then, so I'll go back up. I just want to show you a quick screen and how it works. So once, if you become a partner and you have that username and password, you can go to the left here and go to partner login. And then we'll put in a username and password, hit login. And there's this little, we call this our partner news feed. So, you know, you'll see here, we have a call to action around protecting SNAP. We did a little blurb about the changes to the cost sharing reductions under MNsure, you know, updates to programs, or the website can come here. So you just get information about that as well. This is where we collect all your screening data. So you can, you know, filter by date. So if you wanted to submit a report with a grant that was in the last 12 months, you could filter the date, hit partner report, and it's going to generate a report that shows the number of screens, the number of individuals included in the screens, the percent eligible and interested, total and by program, their average and median income, and then the total annual benefits you brought to those families. So it's a nice clean report that you can automatically generate through the system when you have a login. And then, so to actually get to the screening tool, we do have what we call advanced, a quick version of the tool for partners who use the site a lot. It dumps all the questions on one page. And when I do this over the phone with people who call us, it takes me about 2 minutes. It's the same questions, just in a different, easier to use format. The screening tool full version kind of guides you through the process. So provides that extra guidance for people who haven't used the tool a lot. So I'm just going to show you a quick screen. This first page pulls out a couple populations who are eligible for the programs, but sometimes eligible in a different way. And we provide background on how they might be eligible, and then a referral to services. So if someone has a disability, you know, we're screening for the straight MA programs, not programs for the disabled. So we, you know, tell them how they might be eligible, say they should still use the tool, and then refer them to other services. So I'm just gonna click next here. Kind of hard to.
Next underneath that.
Yeah,
box.
can I just do this? Or should I put it to the other side? There we go. And so this page is kind of our warning label saying, you know, this is a screening tool. It doesn't guarantee your eligibility, apply for you. It also, we don't ask for any personal information that identifies people. So it's private, and non-citizens should use it to make sure that because they are eligible for many of the programs. So who are you helping? If you were screening someone, you'd put a client, but I'm just going to put, I'm just playing with the tool. Then all of our resources are county-based. So you want to enter the county that you're screening for. So one thing to note, if you're in Hennepin, we do separate Minneapolis and the suburbs because where they go to apply and some of the services are separate. So I'm going to put Ramsey County. This tool is a smart screening tool. So if you say you have children, it'll ask you questions about the children. If you say you don't, it won't ask those questions. So describe your living situation. I'm going to say I'm single, but married, living with my spouse, unmarried, and living with the parent of one or more of my children are options. These blurbs help answer the questions. Those aren't there in that advanced tool. So this kind of guides you through, like I said. Do you plan to file taxes? Yes. Is anyone in your household pregnant? If you say yes, you can enter the babies expected that are counted toward eligibility for medical assistance. Do you have any children ages 23 or under who live with you half the year or more? Yes. Now questions about those kids come up. So I'll put the ages of their children. None of the children are pregnant. And then how many do you plan to claim on your taxes? We'll put 2. hit next, and now it asks questions about income. So you can enter income in a monthly or yearly amount. Typically, families know a monthly amount. And of course, you know, when you do a screen, you don't need pay stubs, you don't need exact amounts. You just put in a good estimate that you can get with families to get them through the process and find out what they're potentially eligible for, to do those referrals if they come up eligible. And then we do have unearned income separated into 2 categories. And then there are some healthcare deductions, income deductions that can be for healthcare programs. So you can enter those if that applies. And then the last page is about anyone else in the household or that you claim on your taxes. So is there anyone in the household that lives with you that share meals and expenses that haven't been counted? So you could enter those people here, enter their combined income, and then it asks about anyone else they claim as dependent on their taxes that hasn't been counted. You'd enter that, enter their income, and then results. And you'll see we list each of the programs that they're eligible for, and then we estimate the benefit amount. So medical assistance, free healthcare, school meals, free school meals. SNAP, we do an average benefit, and then if they would like, if they're not already on the program, you can click this link to enter their expenses, which count towards the eligibility estimate, and put those expenses in, and then hit results, and it'll bring you back to the results page and now have an individualized SNAP benefit estimate. And then WIC, $173 in food vouchers, a $281 annual energy assistance grant, free healthcare for the pregnant woman. We estimate their biweekly copayment for childcare assistance, and then their 2 tax refunds. And then here, clients, and you should indicate if they're on the program already or not interested, so that information will be filtered out in your data and in their corresponding results. So I'll just keep interested for this sake. Select I want to apply. And so this creates a personalized application plan for them that you can, once you get to that page, you can email to them or print and have everything all in one place so they know the steps they need to take. The option one-on-one comes up and is the default for most. That's that application assistance, so getting help over the phone or in person to apply. And the programs have multiple ways to apply. So for MA, you can apply online through MNsure. There is a paper application. This over here would be call-in, but you can't do that, so it won't let you. School meal, it's just print and delivered to your school. So it just depends on the program what the options are available. So you change those based on their preferences, select get your application plan. And this is where they can send that email referral to the assistance agencies listed here that will follow up with them and help them apply and enroll. So they're determined eligible. Once you send this referral, someone's going to call them and make sure that they apply and enroll. So that is, you know, there's a lot of work you're likely have to do with clients. Navigating them through these applications doesn't have to be one of them through this process. So you can leave that to these experts. So then you'd enter their contact information. You do have to do a name and phone number. You can even indicate if they prefer text message or what their preferred language is. You can also put notes here. I mean, this client is in inpatient treatment, will be discharged in a couple weeks and is trying to get off their feet, needs help, whatever it may be. They're homeless. This is how you get a hold of them. And then you can indicate who you want to send it to. So in Ramsey, and these will change based on the county. So we try to have them as localized as possible. In the metro area, we do have localized resources in all the 7 metro area counties for energy assistance, the healthcare programs, and SNAP. In Ramsey County, we have Think Small for childcare assistance. In all counties across the state, we have an agency that accepts referrals for the healthcare programs and SNAP, since those are the most difficult to apply. In some counties, we don't have access to a localized resource, so Portico and the Minnesota Food Helpline take those. But so you'd fill all these out, check all these boxes, hit send, and it would go to the inbox of a person at these programs that would follow up. I'm going to hit skip so I don't send the referral. Yeah, and this is the last page that you land on, that personalized application plan, and it lists the program and tells them the exact step they need to take to apply with the information necessary. So For MA, it says one healthcare program can be used to apply for MA for all household members. Contact the assistance agency below. If we actually sent the referral, it would say an email referral has been sent to this assistance agency. They will follow up with you. For school meals, we said print and mail in. So download, here's the link to the application, mail it in. And it gives all of that specific information. WIC, it gives the phone number to call. Childcare, even if there is a wait list in their county, we note that, and it says to call to get on the wait list. And then if you scroll even further down, there's kind of a program information page for each program that tells them all the materials that they need to provide as verification, any other rules that may affect their eligibility, or any other factors that they should know. And this page is nice because you can email it directly to them. And once it gets in their inbox, even if it's on their mobile phone, it is activated where you click the number and it'll call and all of that. So it's a really good way to provide them with exactly what they need to apply and enroll. So that's how the tool works. And in a second here, I'll take any questions, but I'm going to leave up my contact information here because I want, if your organization is interested in using Bridge to Benefits, becoming a partner, using a login, reach out to me, and we can talk about who could be involved in a training and getting a username and password set up. And again, that's all free to organizations. So.
Wonderful. Thank you so much. We're going to open it now for questions. Anybody on the call or on your computers have a question for Stephanie?
I have a few. As people are unmuting, remember to unmute yourself in the bottom left of your screen if you want to ask a question. And you talked about if people are in residence in a facility, is it best to do the screening when they admit or when they're closer to discharge, or is there any kind of guidelines for us about that?
Yeah. I think it depends. If they don't have access to insurance, you might right away know, well, they don't have a job, so they're going to be eligible for medical assistance. Then you probably don't need to screen them. There are some residential facilities, though, that, if it's a transition program or a long-term program, they may be eligible for SNAP. They're not going to be eligible for energy assistance, most likely. And depending on if their children are with them, they could get some of the benefits for their kids. And then if they are if they do have kids that are in their custody, and trying to get those benefits, because one thing to note too is if children are living with a relative, they typically can be eligible for medical assistance with all the programs without counting that relative's income if they're not applying for themselves. So I know that's the case of a lot of children that have parents. So it kind of depends. Typically, it's probably going to be upon discharge, but if their family is struggling financially, you may want to think about trying to connect them with the programs if you can.
And then we often get this question from clients, or say some of the benefits might be time limited, or a certain number of times you can use them per year. Like childcare assistance is one I always hear, is you can only use it for a certain amount of time, or only once per year, or whatever the limitations would be. How would that show up for them if that was the case?
Yeah, so we don't actually screen for MFIP, all the programs on our site are not time limited.
Okay.
And don't have any of those restrictions because we don't screen for MFIP. So MFIP does have a 60-month time limit, our cash assistance program. And there is childcare connected with that. But if they're accessing MFIP, they can for sure, there's no wait for childcare assistance. So that's one benefit. But obviously, if they've reached their 60-month limit, then they can't access MFIP or the childcare assistance program associated with it. They could access the child care assistance program if they meet the requirements. So, so the programs that we have, and that's part of the reason we don't screen for MFIP. A lot of people ask why we don't. It is underutilized. A lot of people who are eligible aren't using it. But there's just a lot of different factors associated with it that right now we don't screen for it. So, yeah, there's no other, I should say there is one time limit. SNAP has a time limit. If you don't have children in your household, you can only receive it for 3 months if you're not working 20 hours or more, or meeting some other factors, or to have a disability or anything like that. So we do note that. So that's the only time limit. And so but if they're, exiting treatment or something like that, getting them on SNAP is a good idea. And then if they do start a low wage part-time job, you can stay on it if you meet those work requirements after 3 months.
And then I didn't notice on the homepage, was the whole screening tool available in different languages?
It's not. So we used to have a Spanish site, but it wasn't used very often. We found that people speaking different languages typically access the site with someone else or through a social service provider. So I didn't even show you, good point, that once you get to that personalized application plan page, the final page, you can, if I move this, translate it into Spanish. So you can guide someone through it in Spanish, get them to the end pages, and then send them the information. And of course, there's a lot of other languages that would be helpful. Hopefully someday we'll get translated into those languages. But what we're finding now is that since we can do the referral and you can put that language in fact, Portico and Second Harvest, they have staff who speak Somali and Hmong and some of those main languages, and then they use the language line. So if that's an issue, I would send those referrals and they'll follow up in that language.
Great. All my questions. Any other questions out there? Or clients or cases that you wonder, kind of how it would fit with Bridge to Benefits, or whether you've used it? We can't see anybody, so if you're talking, unmute yourself.
Nothing in the
Or
chat.
yeah, but you can put a question in the chat too if you would rather ask that way.
Something just went green. Nope. All right.
Oh, Cheryl, this is really helpful. Thank you.
Oh, you're welcome. Thank you, Cheryl.
Uh-huh.
Well, as we do each time we meet, we will put the PowerPoint, our agenda, and the recording on our website, on the Wayside Recovery Center website. So if you want to refer a colleague or friend to learn about what we've learned about today, they can do it that way. And then also, as Stephanie has said, she's open to having people contact her directly for both training and demonstration. And I want to let you know that we're looking forward to our first meeting in October, which is coming up. It's October 4th, and the Tubman facility will be here. And Emily Truscott will be filling us in on more of the things that they do for clients and for people in our community. I will send out an evaluation form to you all, and hopefully somebody will send one back. I have yet to get one, so I'm giving you a nudge. Give me your feedback's really important to us, and as I plan out future sessions, if there are benefits or resources that you know about that you think everybody should know about, let me know, and I'll try to connect and we'll share that. Or if there's something that you wish you knew and you can't find the answer, well, put us on it and we'll try to help find the answer too and get them to come in and talk to us about that resource. Or if you have a topic that you think a success project or something, or a success client, we'd love to have you share that with us. Because we can all learn from each other. So next time we meet, October 4th, we'll be hearing from Tubman. And I'm going to do questions one more time. Anyone have any further questions or input? All right, then. Well, we're going to wrap up a little early today. And I just want to thank you all for being here and hope to see you in a couple weeks. Have a great day.
Thanks.